I was joined a short while ago by Professor John McCallum, an expert on gerontology and CEO of National Seniors Australia, which represents older Australians. Professor McCallum, thank you so much indeed for your time. We should have learned from Italy right early on that this is a virus that kills very much the elderly in particular. And we should have learned from the horror in New York that the most likely place for the elderly to die is in nursing homes. And then, of course, we had the virus rip through some nursing homes in Sydney. Why do you think Victoria, even after all that, seems so unprepared?
Look, it's really disappointing we didn't learn from Newmarch and Dorothy Henderson in Sydney. And a lot of the things that are happening now happened there, and we should have really been aware of them. I think the reason is that we're not really able to respond quickly. That the staff and management, although they might have the first 24 hours and the instructions what to do, they collapse in the face of the crisis, and they're not really up to that management. One way of dealing with that would be to trial it before you actually get the problem. That clearly hasn't been done. And I think, also staff we have a low-paid workforce. They work at multiple facilities. They move around in the community, and we've got to improve the quality of that workforce, the quality of its training. And I think another thing, Andrew, is that this is not a caring situation. This is a military operation. Things have to happen, and have to happen quickly.
Yeah, but I just don't quite get it. The governments we had, I accept that for private nursing homes, yes, they may well have been under-equipped for this, but the governments, they were quite prepared to pass laws for hairdressers and tanning salons and all that kind of stuff. But I didn't see the same level of intervention, the necessary intervention, exactly where people are most likely to die.
Yes, and I think that's been slow to work through, because I think with the quality issues that have been identified through the Aged Care Royal Commission are there, and that's in terms of management and in terms of staff. That's not to say those people aren't doing their very best. It's just that the training and skills and quality and systems aren't there to support it. So when something real and something hard hits, it's very difficult for these people to respond.
So what needs to be done now?
Well, I think what they're doing now is setting up an emergency management group, and I think that's critical. As I said, this has got to be treated like a military operation. We're at war now, and things have just got to happen. You can't muck around and wait for somebody to help you. You've got to get in and do it. So I think that's a good start, getting that together. It'll take some time to really get into operation. They're getting new staff in, because what happens is when there's an outbreak, some of the staff have to go home and quarantine for themselves. So you're losing staff. So that becomes very chaotic. So that's got to be sorted out, and things have to happen and have to work well. One of the bigger ones that tends to come last is communication with families and staff and their families. And that's really got to start from the beginning. Importantly, as soon as there's an outbreak, it's important that goes out to the families who have loved ones there, and that they know before it's in the news. I think that's really critical. So getting that communication going at that point, and then while the outbreak is there and how it's being handled, continuing to communicate to people and tell them what's going on. And that didn't happen in Newmarch at all in Sydney.
Right, well, a lot of those things are now happening quite belatedly over the last week and a bit. Why it's taken so long, it's just, I'm just staggered, frankly. But your brief is also to look after the elderly at home. Now, we're talking about people in nursing homes. Obviously, that's, ground zero for this virus. But also elderly people at home are very vulnerable. I've got neighbours who are worried as well. They're very elderly, sitting at home, don't dare to go out much at all. Do we do enough for them? Like I've proposed since April that we create a huge new, almost like a Meals on Wheels military style of volunteers trained who can help people stay safely at home, do the shopping, run the errands, keep them entertained, whatever it takes. What do you think needs to be done?
Well, look, we asked about 100,000 of our members what was concerning them, and then we looked at the people who were caring for someone. The things they're very concerned about was it's very difficult for them to go out and get things. Very simple, isn't it? You've got to go out and get supplies. You've got to go out and get medications. When you're shut down, it's a really tricky situation for them. What do they do? So that's one thing. The other thing is they need help with practical things, just somebody to help them lift things, very basic things. Now, we've got about something like a $60 billion unpaid care workforce going out in the community who are really struggling through this and who are very worried about themselves, worried about the loved ones they're looking after. So I think we need to be able to get information in there. That's the first thing, so they can talk to people, and that really gets them the information they need to be able to manage, and a sort of emergency response that when something happens that they really need help with can be very responsive. In the same way we're talking about residential care. And some of these people are as sick at home as they are in nursing homes.
That's absolutely correct. Professor John McCallum, thank you so much indeed for your time.
Thank you, Andrew.